going on?
I'm sorry, I know I'm not supposed to be here, but Evelyn's school contract's due tomorrow.
I knew I was forgetting something. Let me, find a pen.
Hey.
Hey.
Not quite sure what Emily Post recommends in this situation, but I'm Tom.
Damien.
Hey. Sorry to intrude. I wasn't quite sure when she'd be coming home.
No problem.
Thank you so much for catching this.
Yeah. I'll get out of your way. It's good to meet you, and I'll see you later, hon.
Bye.
So, seems like a nice guy.
Ooh.
Jules, you okay?
No, my stomach.
Here, lie down.
Ow.
Try to...
Get Tom. Ow.
Interesting case. 35-year-old woman with fever and abdominal pain. ER ruled out all the usual suspects.
Stop before you interest me to death.
And she's in an open marriage.
That's not interesting. It's just weird.
You know what's weirder? That other humans are monogamous in the first place. There's no other species on the planet that mates for life. And if you're gonna bring up swans, they cheat like everybody else. They just have better PR than rabbits.
Animals also eat their young and kill their rivals. That make it weird that most of us don't.
Says the guy whose opposable thumbs have been all over how many women who aren't his wife?
A functional open marriage is like a unicorn. It's a mythical creature that doesn't exist. Someone always ends up unhappy.
A patient's unhappy because she's suffering from an intestinal blockage.
Boring. I'm gonna have to find a reason to rule it out.
What about herpes colitis? She picks up the infection from one of her partners. It takes root in her colon.
STD panel was clean.
Chances are this couple was unhappy in the first place. This is their attempt to save something that never... Go on.
Herpes might not register if she was exposed in the last 6 weeks.
But it would show up on a barium enema.
X-ray was clean. She doesn't have herpes colitis or abdominal pain.
It stopped hurting during the x-ray, which means it was just an intestinal blockage in the past. We should discharge her.
Absolutely. Just no need to find any underlying cause. These things never happen twice. Take her digestive system for a test drive. Give her a radio-opaque milkshake. X-ray every 15 minutes to see if it makes any unscheduled stops on the way through.
We'll be here all night.
Old Tao will be here all night. Go talk to the unicorn and tell me you don't believe.
I think something's wrong.
With your stomach?
My heart is racing.
Try to take deep breaths. I'm gonna try to slow your heart down.
Is this because of the blockage?
No, it's not working. Need a crash cart in here?
You need a list of all your sexual partners from the last 6 months.
Why?
Your wife had an arrhythmia. The progression of symptoms from bowel to heart makes a parasitic infection most likely. Since Julia hasn't been out of the country.
The only place that I've been recently is a business trip to Nebraska.
But either of you could have picked up a bug from one of your partners.
It's kind of complicated.
How many partners are we talking about? Ballpark.
None.
None.
We have a great sex life. I don't need anyone else.
So why not just tell her that and close this whole thing up?
You married?
I was.
Did you ever agree to go see a chick flick with your wife or pretend to enjoy classical music?
Stravinsky never groped my wife in a midtown hotel room.
She needs this. I don't. But I don't want her to feel bad about that.
They're both screwing around, that's one thing. But she has a piece on the side and he doesn't. The only way he'd be okay with that is if he's betraying her in some other way that in his mind makes them even. A unicorn isn't a unicorn. It's a donkey with a plunger stuck to its face.
Right. Even a guy who's not cheating is doing it for underhanded reasons.
No, he's not being cynical. He's assuming the husband is doing something to even the score, which means he thinks there is a score, which means, cheating swans aside, House believes in monogamy. He's being romantic.
What I believe is that men are genetically engineered to be jealous. Doesn't matter if I think there's a score, I guarantee you he does. Any of the wife's partners pan out?
She's been with 2 people other than Tom in the last 6 months. Neither of them have been outside the tri-state area.
So we're back to the husband.
You just said you believed he wasn't.
He's doing something behind her back. What better cover than a business trip to Nebraska? Like that's really a place.
Counting notified you 2 days ago about your patient's insurance.
Sorry, that's NSFW.
Here. He doesn't have any. Try not to bankrupt them.
Oh, I'm long past the number of procedures that will bankrupt him.
Julia's got insurance. I saw the policy number on the forms.
Policy lapse due to non-payment. I already made 3 calls about this. You should have been aware of that.
No, there's just a mistake. Of course we have health insurance.
We're actually a little behind on the premiums. But I pulled money out of my retirement account to cover it. They said that we'll be fine and
Why the retirement account?
We'll just give you a few minutes to...
By we, she means she.
I lost all of our savings.
Sounds like a secret to me.
Did Tom go home for the night?
For starters, I told him to leave. I don't want him here.
Money is a complicated subject.
Yeah, it's not the money. I mean, the money's bad, but... When we first opened our marriage, I got involved with a guy who lied about being single. And one day his wife calls me. She's crying and screaming and totally out of control. And I felt superior. I thought I don't ever have to worry about feeling this way because Tom and I are honest with each other. Well, here I am.
What's the matter?
My stomach.
Same pain as before?
Yeah, worse.
Get the portable ultrasound in here. We need to get a look at her belly.
Help me.
Treatment's not working. Her left kidney fell last night. The other one's right behind it. It's not ankylosing spondylitis.
Kidney biopsy showed she had IgA nephropathy, which could be caused by or associated with any of these conditions.
We've gone from too few ideas to too many, and our patient's running out of time.
Guy's wife's dying. He stops to buy flowers.
They're from his garden. Mercury poisoning fits.
Those are lilacs. My mom used to grow lilacs. My dad made her get rid of them. There were too many bees. We ruled out HSP because there was no inciting respiratory infection. But in rare cases, it could also be triggered by a bee sting.
We also ruled it out because there's no rash.
Maybe we just didn't see it. Have you been stung by a bee recently?
About a month ago.
What's going on?
I think your wife has Henoch Schönlein purpura. Systemic vasculitis can cause lesions and inflammation throughout the body. It's pretty awful. Which explains why it was named after a German. Actually, 2 Germans. Lesions can pop up in the heart, sometimes in the kidneys, but always on the skin. It means you'd have a rash somewhere.
I don't.
Not that you know of. Okay, I'm gonna have to check your holes. We'll start with the mouth. If there's nothing there, then things might have to get kinky. Say ah.
Ah.
Just kind of hoping for kinky.
Is that good or bad?
We'll treat her with high-dose IVIG and cyclophosphamide. You should be fine. I'm gonna be okay. I love you.
That is adorable. Other than you still wanting to have sex with other dudes and him bankrupting your family, I think you kids are pretty much home free.
Are you crying?
No, I have allergies. I must just be like tearing up.
Henry, I think that's blood.
What? I
35-year-old male cries blood and he's not Vampire Bill. Go.
Should we ask?
Nope. What, her? Yeah, my favorite companion is retiring from campaigning, so I'm interviewing replacements. Thank you, Butterscotch. Is that a family name?
Lymphocytosis works. Maybe we should take another look at the blood.
Could also be cavernous sinus thrombosis. Clot builds up pressure at the base of the brain.
We run the patient's blood panel and get a CT venogram of his head, see which one of you is right. How are you with small appliance repair?
This cavernous sinus thing, is it dangerous?
If Henry's got it, we could treat with a combo of drugs and surgery. Success rate is over 70%.
Do you want me to call Amy again?
No, it's fine.
Amy's his girlfriend. I'm the neighbor. I did leave a message at their number.
Do you want to try her cell? Be here for a few more hours at least.
Or she doesn't have one. She worries about radiation.
I could stop by on my way home. She knows who I am, right?
You don't need to, but thanks.
CT showed no clots or malformations. Park and Taub ruled out lymphocytosis and diabetes.
Well, since you have nothing of relevance to report, I assume that you're here to toss your panties in the ring.
Patient's got a mysterious girlfriend he really wants to see. But she's unreachable by phone, and the neighbor's never even seen her.
What do you think?
He's gay. I think he's a junkie. The girlfriend is a fix. The guy's inhaling glue.
You repair a blender.
Can you bite me?
Go search the patient's home.
Oh, God. I don't think she's breathing. You think she OD'd?
That would have killed her. Pulse?
No.
Call the coroner.
I don't think that's gonna be necessary. Our patient is not a junkie, but he does have a girlfriend.
I call her my girlfriend because people understand that. If I explained it, they'd just think I was a weirdo.
We're not here to judge anyone's fetish.
I'm not a pervert. It's not like I'm more attracted to dolls than humans.
So, you don't have sex with her?
It's not just about that.
Does the doll talk to you?
I know she's not a real person. In a lot of ways, she's better than a person. I can tell her things and she won't argue with me or make fun of me. I come home every night and I know she'll be there waiting.
So's your toaster.
No one in the world has an emotional attachment to a toaster, but a lot of people are willing to spend $7,000 on women like Amy.
Have you ever tried an actual?
Yeah, I'm 35. I've been in relationships. None of them fulfilled me. And one day I saw this website and maybe the perfect woman's out there somewhere, but it's not worth going through what it would take to find her. Amy makes me happy.
Sweating.
It's sort of hot in here.
Not that hot.
Bleeding plus 2 new symptoms, fever and neurological.
I'm not sure about that last one. I think he's just weird. He wasn't hallucinating. He didn't have a thought disorder.
You don't think it's disordered to talk to?
It's not all that different from talking to your cat or a teddy bear.
You don't have sex with your cat or teddy bear.
If you did, you'd probably talk to them more.
What about the patient?
Dude's banging a sex doll, festering cesspool of bodily fluids and associated bacteria. Swab her out and find out which one.
Will this hurt?
No. Might feel a little cold, though.
Crap.
Hey. And I'm second, but I went to the time travel lecture. Whoa. That is awesome. What is it? It's so realistic. Oh, and it's all bandaged up. Is it one of those CPR things?
No.
We're starting a procedure. A little privacy.
No, it's good that she's here. Molly would like you to meet Amy.
What?
I'm serious. I know it seems a little strange, but she means a lot to me.
I gotta get back to work.
You just got here. Sit down.
Yeah, but I said that I only had a second. Enjoy the handouts.
It's nice having you here. I wish you could come over and get in bed with me.
Like this?
You're talking?
It's not all I can do.
Pushing lorazepam. Wasn't neurological before, it sure is now.
Right upper quadrant's distended. He's hallucinating because his liver's failing. Fever's at 105. He's not responding to meds. At this rate, he'll be dead by the time we get the cultures back.
Spinal fluid was full of white cells. Meningitis could be carcinomatous.
Cytology showed nothing.
An amoebic infection would cause fever and meningitis.
But not liver failure.
It could if you had a clot.
How would amoebas get past his cribriform plate? He went swimming in a frozen lake in New Jersey?
Adam said his ex-girlfriend was a yoga instructor.
Maybe he sprained his chakras.
Yoga nuts are way more likely to be into alternative medicine. He had this little weird teapot in his house.
What was it like?
A little weird teapot-ish.
Like that?
Yeah.
You think he drinks some sort of toxic herbal tea?
Yes. If by tea you mean salted tap water, by drink you mean poured up his nose. His girlfriend didn't just leave him with a broken heart, she left him with a neti pot. It's an Indian method of clearing the sinuses during allergy season, also known as now. With distilled water, it can act as a snot flushing system. With tap water, it can act as an amoeba delivery system to the fluids around the brain. Start him on metronidazole. If he's lucky, he'll get to see his plastic children walk down the aisle.
My neck feels much better.
Your fever's gone and your liver function's almost back to normal. You should be able to go home soon.
I'm gonna have some hospital bills to pay. I don't suppose used sex dolls go for anything online. Dr. Adams? Can I get your email?
What for?
Just thought maybe we could see each other again.
I can't.
No, I know it's a professionalism thing, but you won't be my doctor when I get out of here.
It's not that. It's...
What is it? You said I should change my life. You were talking about yourself, too. I know you were.
Henry, I think you should ask Molly out.
I should have known this would happen.
You're a good guy, Henry. You deserve more than a doll. Promise me you'll keep trying.
Sitting in a tree.
Grow up. Learn to harmonize.
Damn it! I'm sorry. I'm sorry.
Who the hell walks around with an open urine sample?
I'm sorry. I didn't.
You think that was a bit of an overreaction?
Well, he peed on me. I'm not into that.
It's apple juice. Go find that guy and apologize. One more patient complaint and you're looking at a suspension.
I forgive you for ruining my jacket. Look, you seem like a regular kind of guy. Not the type to get another regular guy into trouble, all right? $20 cash if you'll stop crying. Forgive me, yell at me. Just give me something I can work with, okay?
Game's over. You two make nice.
Get a wheelchair. I'm gonna get this guy into the ER.
What happened?
Right pupil's blown.
Holy, you gave the guy a stroke?
21-year-old male comes in with grinding of the teeth.
And House gives him a stroke. Totally blew out his pupil.
You scared a guy into stroking out?
Does that surprise anyone here?
Blown pupils usually means brainstem edema.
Sure. But since he's not dead or in a coma, I'm going with stroke to the optic nerve. CT scan shows two things.
Ischemia. Death of brain tissue. Means there's been some damage, hopefully not permanent.
And?
That's it. There's nothing there to tell us what the underlying cause is. Got to do an MRI.
You're looking at the wrong part of the scan.
Looking at the brain, what else is there?
The jaw.
The jaw tells us why he's striped.
No, the jaw tells us why we can't do an MRI. Unless we want his jawbone flying across the room.
Metal plate. He's had major reconstruction. There's no way we're removing it, so we're forced to be clever. Angiogram to rule out vasculitis, EMG for peripheral neuropathy, tox screen to eliminate drugs, and echo to rule out cardiac emboli.
Morning. Harvey, I'm Dr. Foreman. I'm here to discuss your case.
I'm Annette. I'm Harvey's friend.
Nice to meet you. I need your next of kin. You didn't fill that out on the intake form.
Harvey's parents are dead. They died 2 years ago in a car crash.
I see. So, Harvey, you have any siblings?
No, and no grandparents or uncles or aunts.
Annette, I don't want to have to ask you to leave.
I want her to stay.
Well, she can stay. You do the talking. Why'd you come to the clinic this morning?
About 6 months ago, I started grinding my... You know, in your mouth, you chew with them.
Teeth. Harvey's experiencing a little nominal aphasia. You know, when you can't remember nouns.
Yeah, I think I know what nominal aphasia is. Have you had any treatment for the teeth grinding?
I went to you know, they do that thing with the sharp, pointy things.
Needles? Someone took your blood.
No, they make you breathe.
Pulmonologist.
No, she had this, she had that electrical machine.
He saw an acupuncturist.
Mm-hmm. Do you know what the acupuncturist did?
She diagnosed liver chi stagnation and sent Harvey to a Shen balancer. He referred him to a homeopathic doctor who sent him to a chiropractor.
Naturally.
Well, the chiropractor thought it might be food sensitivity and sent Harvey to a naturopath.
The naturopath sent me back to the...
Back to the acupuncturist.
Yes.
Okay. Well, we'll need to see the records of all of those practitioners.
Thank you.
Oh my God. What the hell are you doing?
She's choking him. The foreman, stop.
Let her go.
She was trying to kill him. No, she wasn't.
His vitals seem okay.
Please don't hurt her. What the hell is going on in here?
She's a dominatrix. Right, Annette?
The patient asked you to strangle him.
Harvey is an asphyxiophiliac. He likes to be strangled or smothered.
That's just sick.
Well, that's an intriguing legal opinion. Geez, what kind of a lawyer is he?
You want a legal opinion? Call the cops.
I was careful. I watched the monitors, made sure his O2 sats were over 90. I would never hurt him.
Then what was the point?
Harvey was upset. He needed to calm down, to feel in control by being controlled.
He pays you for this?
In return, he does my taxes and cleans my house.
We're not done here. We have to talk.
Call the cops. Bar her from the hospital. Force her to pierce her nipples. Not really medical decisions.
It was a long time ago. I was seeing this woman, a banker, and turns out she liked to be burned.
You actually dated someone who likes to get burned?
Yeah, why would you want to be in a relationship with someone that's so obviously only going to lead to pain?
Shut up.
It was a weird scene. I observed.
Chase, do you know about this woman? What she does?
I met her at some parties, yeah.
I wouldn't have tortured you if I knew you liked it. Well, here's a phrase to remember. Hey, this guy might have been pounded on the head one too many times.
I said I thought it was a trauma-induced aneurysm.
Yeah, could have carried a tad more weight if you'd mentioned the liking pain thing. You're on my naughty list. Sorry, no leather stethoscope this Christmas.
I'm not into...
I assume you never started him on antibiotics and blood thinners before Mistress Ilse's rude interruption.
It's probably a good thing.
Start him on antibiotics and blood thinners.
Surgery will repair the damaged blood vessels in your neck, and your strokes will stop.
All this was because of the strangulation.
More like strangulations.
My parents are right. I'm a loser. I don't know what to do. I need to...
Harvey, calm down.
Talk to Nedd.
You can do this on your own. Surgery's the only...
She hates me. I've been calling, and she's not picking up.
Harvey, you don't need...
I can't.
Harvey, you will do what I say.
I don't want surgery.
Sign the consent. Sign it.
I can't do anything. No surgery. No surgery. No surgery.
We could give him antidepressants, see if he changes his mind.
I already did. Mashed him up in his applesauce. It'll lighten him up soon enough.
Someone should just tell him to do it. Way faster.
So it's forgery, also illegal.
And I already tried.
Not you. Where's a good dominatrix when you need one?
Annette's barred from the hospital.
If you get caught, Cuddy's got a hairbrush. Believe me, she knows how to use it.
They let you come back.
Not because you deserve it. You've been bad. You will have the surgery. Do you understand? Do not laugh at me. You will respect.
Where do you get off telling me what to do? Get out of my room, you back-faced witch.
Is this a part of their deal, or?
This isn't like him. Something's wrong.
Get out! Get out! Get out!
Emotional swings. He's having another stroke. Harvey?
He's crashing. Can we get a card in here?